The landscape has changed. Routines have been uprooted. The effects of COVID have challenged all of us in the last few years. We've made so much progress and our communities are coming back, but there's still much more to do.
So Chelsea has always had a homeless issue, although it's not your traditional homeless situation that you see in other cities and towns. Your homeless population is people that live in overcrowded conditions. It's going to take us years for us to be a little bit better with the housing situation and the homeless situation.
Ending homelessness means more than simply finding beds for people to sleep in. It means changing the system. That's why we worked with the Commonwealth to create Pay for Success, a sustainable, self-funding approach to reducing chronic and long-term homelessness. When we concluded the program this year, more than 1,000 people had been placed in stable, supportive housing, and the cost savings in shelters and emergency room visits were enough to fund services needed to keep them in their homes. This year, United Way built on that success and advocated for the allocation of ARPA funds, resulting in more than $150 million for supportive housing.
The team that I work most closely with at the United Way addresses these issues with the same energy that you would if your sister or family member was experiencing homelessness. And I think that if we all personalize the issue in the way that our partners at the United Way have, we can accelerate the expansion of these innovations to reducing homelessness.
At a time when the economy is struggling and inflation is the highest in 40 years, we launched a public information campaign that helped more than 4,000 Bostonians learn about how to improve their credit. And as more families experience food insecurity, our partners, donors, and volunteers continue to rally, providing more than 20,000 meals for families in our biggest Thanksgiving project ever this year. The COVID crisis disrupted in-person learning and socialization that young children need. To address this issue, the state tapped United Way as a summer step-up partner, and together we helped 2,000 children in 30 communities start the new school year ready to learn. Since the onset of the pandemic, our United Way AmeriCorps program has adapted new ways to supporting multilingual students remotely. For the first time since 2020, the AmeriCorps team is back entirely in person, providing social, emotional support to nearly 1,000 K-12 students in Lynn, Salem, and Gloucester. At a time when innovation is desperately needed, our venture fund helped nonprofits to quickly adapt to the challenges of the crisis. When the Mystic Valley YMCA's tiny food pantry couldn't accommodate social distancing or the overwhelming increase in need, they went digital. With venture funding from the United Way and Aetna, they launched a new digital food pantry that tracks inventory, collects household data, and sends alerts to families so they can get exactly what they need. Now that same technology is being adopted in more communities and is reaching even more families. Innovations like these will help more people get the services they need before setbacks become catastrophes. We know that we can't solve the big issues without addressing the racial and ethnic inequities that exist in our community. We need to listen to those voices and honor those experiences. We need to go deep into our neighborhoods and understand what they need now. Our Community Conversation series will help us understand what people in the hardest hit areas really need in order to thrive, and will profoundly influence our work going forward, now and into the future. Now's the time to make powerful change in our communities. It's time to focus our partnerships on equity-driven solutions. Together, we will be an unstoppable force for economic, racial, and ethnic justice.